Hey there. In this video, I want to talk about sciatic pain. Hey, this is Wei, your exercise physiologist. So, for sciatic nerve problem or sciatic pain, you usually read this and you notice that people will talk about having, the nervy sensation that's running down the back of your leg. So, most of the time, when people have got sciatic problem and they come to me and they say that they have a sciatic problem, I usually also want to understand what's giving them the problem, because when we look at the sciatic nerve, it actually runs down from the back of your spine and then all the way down to the base of your foot. So I'll just show you the anatomy, and from there you have a better understanding of this sciatic problem or sciatic pain. Okay, so let's go. So over here you see the entire body. I'm just going to peel off the different layers that you see over here. So obviously you have all your muscles made up over here, and if I were to peel the muscle layers off, you start seeing something that is yellowish in color, and that would represent our nerves. Okay, so let me just bring everything that you see over here away slowly. Right, so let me slow it down a little bit over here, and I would like to zoom in from here. See, this is your sciatic nerve. All right, well, if you look at where the nerves are right now, theoretically, people only think that the sciatic nerve starts here and ends here. But practically, if you look at where the nerves run, okay, so I'm just gonna click somewhere else so you can see everything. It runs all the way down to the base of your foot. Let me also just remove your bones. Okay, so this yellowish thing basically is the sciatic nerve and all the way down. So you'll get different names, or of the nerves, and people will be saying, oh, this particular nerve will be giving you the problem and things like that. But if we are talking about the sciatic nerve, I usually look at the entire thing, and it doesn't just start here, ends here. If we were to go all the way up, so let me just remove this whitish tissue over here. You will then see that the sciatic nerves actually comes from here and all the way up here. Okay, so I'm going to show you later on theoretically what the nervous system does. So anatomically, you can see that this is where the sciatic nerve runs, and it starts here and it goes all the way down. And because this is like one of the biggest nerve that it's around the back, starting from your buttock. Okay, let me just bring in some muscles here. Okay, so people will usually feel something around the buttock area, and some people will feel something behind the back of the thigh, and some can even feel all the way down to the base of the foot or even the calves, right? So I wouldn't say that you definitely will feel something here, you definitely will feel something here, or you definitely will feel something here. Because what this sciatic nerve does is that it is actually picking up signals along this yellowish thing that you see over here. And that's how it runs in our body, in our system, right? So there's no definite to say that, oh, okay, this particular place has got a certain issue, it's definitely the sciatic nerve. How I usually think that it is affecting the sciatic nerve, or the sciatic nerve is actually picking up signals, is because Usually during the session, the patients would already be giving feedback to say that, oh, I can actually feel something running down. It could be numb, it could be tingling sensation. Some even feel pain, but these are what we call referred pain. And it has got nothing to do with somewhere along this line. And usually I'm pressing or I'm actually doing some release around this area. Right? And they can actually tell me that they're actually feeling something running down. Sometimes at this area, sometimes around this area, and you can see there are also nerves running and coming over here. Right? So this is what anatomically I want to show you, because it could be something happening around here. It could be something happening around here. It could be something happening around here and around here that allows the sciatic nerve to function properly and to send you signal, or to send the signal back to the brain to say that something is not quite right there. Okay, the sciatic nerve is actually doing its job. It is signaling your brain to say that there's something wrong down this line. Okay, there's nothing wrong with the nerve if the nerve works this way. Please understand this. Okay, so if you were to look at, you can search anywhere on Google. The very common place that most people will land up on will be the Wikipedia. So if you want to read more, you definitely can. And I'm just going to keep it simple because the very first line would already tell you this. And this is what I meant. The nervous system is a highly complex part of the animal that coordinates its action and sensory information by transmitting signals to and from different parts of its body. If you really understand this, or if I really just keep it simple, the nerves are just picking up and sending signals. That's it. Period. Okay? So I'll just leave this part done here. Alright? So that's it. So there you go. For sciatic problem, if you look at the entire anatomy, you realize that there's actually many things involved here. The sciatic is usually just the brain picking up signal and sending it to your sensation, and that's where you feel something. So most of the time there's nothing wrong with the sciatic. It's actually just picking up signal in the form of the things that's going down, and that's giving you the problem. So yes, if you're looking at this, now you have a better understanding of sciatic. Have somebody check, because it's almost not possible to check anything behind you on your own. So once you know what's giving you the problem, you can then treat the root of the problem. And when you get it done, you shouldn't be picking up signal with the sciatic, right? And one thing that I don't want to miss out is that a lot of times people think that there's something wrong with the sciatic nerve. There's actually nothing wrong with the sciatic nerve. The sciatic nerve is basically picking up signals. Along the way, there may be something that is allowing the nerve to be picking up the signals. Okay, so have it properly checked. There may be something that is, blocking or making the sciatic nerve having some problems with its normal operation, or it's just picking up signals because there may be some tightness, tension around the back. Alright, to have it into problem, you usually need it to get into a cut or something that has got a lot of impact. There's very little chance of people getting into a nerve problem. Nerves goes the same for throughout the body. So have it checked. Usually nerve doesn't have the problem. It's something that it's along the way that's making these nerves pick up signal. Okay, so there you have. That's for your sciatic nerve. Please take care, and I will speak to you soon. Bye bye.